Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio on yet another rainy morning here in Kansas City. But while we are delighted to be back in the rain, not really, we really are delighted to have Dr. Lee Norman, Secretary of KDHE, joining us back at the studio. So good to have you back in the studio, brother. What's going on?
Thank you.
How
Good
are
to be
you?
here.
Thank you. It is just an absolute delight to have him back in the house.
Yes.
And he's got some sobering news to share with us this morning, and we're going to get to that news in just a moment. But first, Doc Hawk, Medical Director, Infection Prevention and Control. I'm supposed to say that every morning, and most of the times I don't. Today I spit it out.
That's all right.
Yeah, how are we doing today?
I thought I was going to be able to just kind of phone it in. We have our expert, who's been just a great voice throughout the pandemic.
He has.
To help all of the state. I think really the metro area and probably even reaching across state lines as well. So just a great voice and expert that we are privileged to have back here. We are doing really well. Hays has 1 active and no in recovery, so 1 total. We here at the hospital, at the health system, 6 active infections, 1 in the ICU, but none on the ventilator. So that's really good. And then 12 in that recovery period, so a total of 18 patients.
Yeah, so still we're really low.
I think we're very happy about this.
Hey, we promised yesterday we were going to give some data on who's been vaccinated in our here in our at the health system. So here we are. Here's a graphic, and you can see we've gotten a number of people vaccinated in their 90s. And while it's not showing, I believe we actually have vaccinated 2 to 4 people who are over 100, 4 people who are over 100 years old, a number in their 80s, and you see there's lots of folks in their 70s and 60s, which makes sense because we know that these are the folks who are really the most vulnerable. And you can see both first dose, second dose, and then you can see us taper off a little bit, but still plenty of people getting vaccinated in their 30s, 40s, 50s, 20s, and now the emerging folks under 20. So we're delighted to kind of share this information with everybody. You can see in some cases we're up to 16,000 in an age group like those in our 60s. My only disappointment in this graph is that those numbers aren't 2 to 3 times high with that. We have vaccine that is expiring on the shelf because we don't have an arm to give it. We're trying to give it out to other places and say, hey, do you guys need vaccine? And what we're hearing repeatedly is, no, we don't need more vaccine because we can't find enough arms to give it to. And I keep thinking to myself, why is that? Why can we not find enough arms to give that vaccine out there? So I would love to go ahead and go right to reporter questions, but I'm going to first talk to Dr. Norman for just a minute. Dr. Norman, we don't have enough arms. What's going on?
Yeah, well, in the first 20 weeks, we did 2 million vaccines in the state of Kansas. So if my math is correct, and I think it is, 100,000 immunizations a week. And now we're doing about 8,500 a day. So we've dropped down to about 2/3 the number of vaccines that we're giving. And we are flush in vaccine. So we are putting the pedal to the metal in terms of vaccine hesitant. And I think we're finding also that there's a lot of people that I would call the vaccine lazy. They just plan on getting it, but just haven't gotten around to it yet. So our strategy for reaching those individuals is dramatically different than what we've done in the past with mass vaccination.
So what is that strategy going to be?
The strategy, and we're doing it, and it's working, but it's very inefficient. And that is, we're going out to the communities. We're going down to fishing holes behind dams. We're going into tough-to-reach communities and are just having to be happy with 50 to 75 vaccinations at a time instead of 1,000 a day, which is a dramatic shift. But it's got to be that way because the mass vaccination clinics, as you pointed out, Steve, are not carrying the day anymore.
Yeah, we've tried to use our mobile van. We're going around all sorts of places, from country clubs to churches to educational centers, wherever that we can go to give vaccine. We're ready to go on the road too.
Yep.
And I know you described going to a dam one time where people had lined up to fish routinely, and you were given vaccine. That's a great story.
Yeah, and there's so many great stories that haven't been told. At another place that was like that, we had a trucker that was driving through and saw one of those electronic K-dot road signs that says free vaccines, come on over at blah, blah. And he dropped off his load at a rest stop and came in and went through the drive-through in a semi. So we're having to be pleased with the onesies and twosies, and would rather do larger numbers, and at this rate it's going to take a long time. So I think it's really important to emphasize that people come in to get it now.
So what do you think about how long it's going to take us to reach herd immunity, if that indeed is a concept? And I think that it is. But how long do you think it's going to do to say, man, we've really got a lot of people vaccinated?
Yeah, I think it's a great question. Herd immunity, and I'd be curious to hear what Dr. Hawkinson has to say, because I don't think of herd immunity as a number necessarily. I think of it as diminished or absent community transmission. But if we say, what does it take us to get to 75%, it'll take us 7 months at the current rate. And it's not the 65 and olders that are, because they're all at 80 to 90% vaccinated throughout the state. It's the people that are more of the 20 to 55, 60-year-olds. And when we get to that population, it'll go up quickly. We're getting a lot of vaccinations to 12 to 18-year-olds.
Yeah. I mean, I think that's an interesting question. There are a lot of levels of that. Just in the context of coronavirus, we know for the regular cough and cold, human coronaviruses, of which there are 4 that we've known about that have been endemic within the human population for hundreds of years. We know that you can get reinfected with those, 3 months to a year from infection with that original one initially. But mostly your symptoms are probably improved. So I think we have to understand, what does that look like? I think certainly for our most vulnerable population, those in that age group above 75, those in the nursing homes, if we can keep those patients protected and keep them from out of the hospital, and then if the younger populations can then get vaccinated, I think that herd immunity or that population immunity certainly is going to be, just as you said, what is the spread? What is the concept of who is still susceptible to that disease to have those outcomes, such as the acute outcomes, like going to the hospital and severe disease, but also, like you've mentioned numerous times, what about those outcomes of the long-haul COVID? Because that is not anything to be diminished. That is a significant problem, and that can affect people for months on as well. So I think there are a lot of ways to look at what and how are we going to get to population immunity. But starting with this group, 12 and over, if we can vaccinate as many people as possible, moving down the road in 6 months to a year, I think we still will be better off.
So one of the questions one would ask is, if hospitalizations are the bellwether of where we are, since testing is so much less, what are you seeing throughout the state, Dr. Murray?
Well, funny you should ask. The new cases, granted, 1 week does not a trend line make necessarily, but we really pay attention to the most recent week or two. We're down 9% in terms of the total number of cases, but that is the nuance there, of course, is testing. But when we look at admissions, they're down 27% statewide, and the death rates are down 20% statewide. And curiously, the percent of positive testing is also going down by about 0.3% during that week, which is kind of hard to explain because we're testing more asymptomatic people and less surveillance or asymptomatic people. So net of all that, it's going the right direction.
Some people have argued that we're going to see a rise in RSV and other common cold and flus because people are taking their masks off, and one wonders if we're just getting more symptomatic people or infected with other things these days.
Yeah, well, this past winter certainly taught us a lot about influenza and the absence of the number of cases. But I think we're certainly going the right direction with all the viral respiratory infections, and as you say, the masks and social distancing and hand washing and the like really carry the day.
Okay, so here's the big question. This is the most important question of the morning for you guys, and then we'll listen to the reporters ask their very important questions. But here's the most important question of the day. Yesterday, KU sent out applications to get season tickets back to KU basketball at Allen Fieldhouse. Are we going to be ready to go indoors for 16,100 people to be screaming at the top of their lungs at Allen Fieldhouse? Dr. Norman, what do you think?
Well, if I say no in the state of Kansas, that's a life-limiting move right there. But so the answer, I think,
he's going to put his mask on permanently, but it's going to be one of those other masks you may have seen him wear a few times on the broadcast.
The answer is, I think we will be able to do that if we get to a sufficient amount of vaccination. But time will tell. I think it should serve as a motivator.
Yeah, it is. And I'll tell you, we've been preaching on this show. Hawk, I know you're a big KU basketball fan.
Absolutely.
Are you going to be ready to go?
I will be, and I think that Dr. Gerard has done great, and I think the vaccine uptake amongst the college students, have gotten before, will hopefully be vaccinated before they left. Hopefully, if not, then they'll be vaccinated before they come back. I think there has been a very good culture change there, so I'm hoping that it would, because if you have 80 to 90% of those students vaccinated, then you have a very good chance of doing that and keeping everybody safe so that they can continue to go back throughout the season to cheer on the Jayhawks. So.
All right. Well, final question from me. Actually, that's not true. We don't have a reporter question online. So I want to take a turn now and talk a little bit about public health care workers. Dr. Norman, what is happening across Kansas with the fate of our public health workers? How are they doing? What's their mental health like? And what do you think this is going to mean for the future, this whole pandemic will mean for the future of public health?
Yeah, this is going to be, I shouldn't say going to be, it is a real challenge. We've had 37 health administrators and medical officers leave. That's 25% of our total public health workforce that has vacated their position for a variety of reasons. There's 55 of us in the United States and territories that are state health officers, and there's been 55 people turnover since March of 2020. Now, some positions have actually turned over twice.
So you're a rarity. You're still in the office, and you're still alive.
Or a slow learner, maybe. But,
or both.
or both. But I think there's money coming in, federal pipelines. I think that we could really bolster our training. And curiously, people are optimistic, young people wanting to come in the profession, say this is something that is important, needs a lot of help. And I think this could serve as a real stimulus to improve our pipeline of training for public health personnel. So.
Yeah, I hope that's right. I hope we see this as a crisis in public health that we need to address in the long run, because there are so many other aspects of public health besides COVID-19, whether it's drinking water or environmental safety and things of that nature. Talk to us a little bit about the reach of what public health officials really do besides COVID-19, although I'm sure that feels like the only thing you've done for last year.
No, that's a good question, Steve. Everybody's been focused like crazy on COVID-19, but during this time we've, normally we have about 15 hepatitis A cases a year, a preventable disease, I might add, and we've been at over 400 this year in the state of Kansas, or this most recent 12 months, I should say. We've had syphilis and congenital syphilis outbreaks that we've had to send in investigative and treatment teams for. We, of course, always have clean air, clean water that we monitor. So nothing else has changed. It's just been additive. COVID-19 was the #1 killer. We looked at a 4-month period at the end of 2019, a 4-month period at the end of 2020, and the causes of death from heart disease and cancer and all the other things were the same. But the #1 killer of people was COVID-19.
So, Dr. Norman, I'm going to go off script for just a minute and ask you a very topical question.
That's
because it's rare, I know. Because, first of all, I know a little bit about your history, and you have been familiar with bioterrorism for a long time. You've done a lot of work on it nationally and internationally. Did this virus come out of a lab, or did it come out of a bat, or both? What do you think?
I don't think those two things are mutually exclusive. Ironically, I was in Puerto Rico lecturing to a group of legislators in December, and in my slide deck I showed a guy holding up a bat, and it said, "Virus rather similar to SARS and MERS found in Asia." So that, I think, and that was a month before the first case was registered in the United States. Secondly, I know that it's been worked with in laboratories, particularly in China. Is it possible that it infected somebody who inadvertently walked out? Of course. Do I have anything to say on the unclassified side that says it was deliberate? No.
Yeah, it's just hard to know. And do you think we're ever really going to understand the origins of this?
I don't think we probably will, but I think that we should trace it back to find out what we can learn about it. And if there's laboratory practices, indeed, that need to be looked at and changed, then we should do that.
Yeah, I think it's a little scary to think we're out there manipulating viruses and finding out whether they can be done and that could kill people. That would be a bad thing.
Well, and Dr. Hawkinson, I know, knows more about this than I do, and that is there has always been research on what is it that can make viruses more virulent, so as to understand how to control the next iteration, the next strain, and that kind of thing. So that may have been part of that type of research, because that's not a new research goal.
Yeah, I mean, I think you have to understand that there are so many populations that live next to animals, next to wildlife, infringing more on their territory. This includes bats. This includes locals actively going into caves to get guano, to get things that otherwise need as well. So there are a lot of humans and a lot of human populations in contact with bats, but also other organisms as well. And we do understand from expert virologists' opinion who work with viruses every day, work with genomes every day, pretty much definitively has said this virus could not have been constructed. So I think that question is, was this manipulated or constructed? Is a different question than did it come out of a lab. I heard yesterday on a virology podcast as well, and I haven't been able to see the actual reports or the news reports about this, that those 3 researchers that were ill were not ill with COVID, and they were tested for COVID and negative. Again, unsubstantiated because I haven't seen the reports. I just heard that on a virology podcast. So I think that is a question to answer and continue to be asked. But just to your point, we also need to continue to develop beyond that, because it's not going to help us too much right now. We need to continue to move forward. In addition, we know that other coronaviruses from things such as pigs and dogs have well-documented infections of humans as well. So this isn't just the first spillover event. We know about SARS and MERS and all those other things. It's a question that can continue to be asked and investigated, but we'll kind of see what happens from there.
So, Dr. Norman, one of the other things to just mention, you've spent a lot of time talking with us in the past about wastewater testing and what that shows and what the rise of variants mean and how we're doing. So talk to us about how is water testing going in the state around COVID-19, and what's the story on the variant here in the state?
Yeah, well, first off, in terms of genomic sequencing, we are doing a spectacular job at building that kind of capacity. There's only one state that has a higher percentage of the variants sent to the CDC for confirmation to see if they're of concern, variants of concern. And we're doing more and more wastewater testing all the time. It's very helpful in predicting what will happen in the next week or two in a community. Something that's related, I think, and it's very exciting, and we're starting to pilot it here very soon, is testing of air. With the same PCR methodologies. Now, this is not new in terms of testing, in the Capitol and Washington, D.C. and other places. Yeah. They've had a lot of air sampling going on ever since anthrax was hit the area, in a deliberate attempt not too long ago. But to do this for COVID-19 is new, and we're going to pilot that in certain areas in the state of Kansas.
And how do you test the air? What is it you do?
It sucks air in, it goes through a filter, and you take the filter and run it through the PCR testing, and it says yes or no. And
you're looking for both volume of virus as well as the types of virus?
No, it's purely qualitative to say if it's there or not. But to your question about KU basketball, you talk about a great place to sample the air.
Yeah.
Because whatever the air handling system in there, I'm not sure it's able to keep up with the number of air exchanges necessary, and that would be a great environment. Also, closed-in spaces like assembly plants, meat packing and the like would be excellent places to pilot it, and even schools.
So what is the variant story like here in Kansas these days?
Yeah, and it's changing every week. 70% of the cases now are a variant of some sort, most of the B117 UK variant. So only 30% of the cases total in Kansas now are the, quote, wild type, unquote.
And any evidence so far of the variant coming from India?
Yes.
Okay, so starting to see that one as well, which is no surprise because these variants do tend to come in, especially when the ones that are more reproducible and spread easier.
And 2 different India origin variants are here.
But I think the important thing to remember here is that early research suggests that the vaccination does offer protection against all those variants currently.
And that's what we believe too, Dana.
So that is good. So now that my last question, then we're going to turn to a question from the audience. The CDC masking guidance has changed, and watching people gather together again, both in restaurants and bars and churches, et cetera. As you look at that information, how long do you think, Dr. Norman, before we're going to see if there is a community-wide ripple effect with rising numbers of cases?
Well, we're thinking that even now we could start seeing it if it's directly due to that. I think a real test will be Memorial Day gatherings and 4th of July gatherings. But the numbers are still coming down. And there was, you remember the big peak, and then there's a smaller peak. And you guys, I know, talked about it in terms of the volumes, and we saw that statewide. We're coming down from that now. Yeah. So if there's a deflection, we'll see it.
Yeah.
It is exciting information to continue to follow and keep our fingers crossed. Jill, I bet there are a few questions out there today.
There are a lot of questions this morning. Jean's going to get the first one, and I think I'm just going to kind of try to go down the line. What are Dr. Norman's thoughts on Douglas County mask mandate? Also, what are the national hospitalizations per day, given that testing is down and the 30,000 new cases are probably not a reflection of actual cases?
Yeah, let me answer number 2 first. The number of positive cases that have been tested is always underestimated the total amount of disease out there. But hospitalizations and deaths don't lie. So, I mean, to your earlier question, Steve, that is really the indicator. If testing went away, we would still have those hospitalizations and those deaths, unfortunately. And question number 1 was Douglas County and masking. A mask will never do you wrong, and I applaud the fortitude of officials who choose to do that if they think that helps to mitigate the risk. I support mask mandates still in areas where there's high risk. And I think it's really reflective of the fact that people need to, even in their own lives, without a mandate, say risk-based decision making. If it's a risky area, I should either go into it or I should go into it with a mask. It shouldn't rely on a rule to make people make the right decision.
Okay, Heidi wants to know, do you know how many doses have expired because you don't have people or arms to put it in?
In the state of Kansas, we haven't had any, to my knowledge, but we're getting dangerously close. That's why we've been working with federal officials to redistribute it. But the states that we could redistribute it to, particularly up in the Northeast, they don't need it either because they've got more supply than demand. So it's really about looking at internationally. And, you know, when you look at Canada and Taiwan, you know, what Canada's given 3% of their population has been
really
vaccinated.
low.
Yeah.
And Taiwan is something low single
Less than
digit.
1, I
and
think.
look what's happening to them.
Right.
So we'd love to help. And we're working in the state of Kansas to see if we can distribute the excess amount, either that is in our state or in the federal depot that is ours to own. It doesn't make any sense to keep it on the shelves and let it expire.
No.
Right. And Maggie wants to know, how are people reacting when you show up at a fishing hole unannounced and say, hey, do you want a shot?
Well, we don't tackle people. We set up a
pun
pop-up
intended.
clinic, and if people, they know why we're there, and they will come over and volunteer for it. Actually, we've been very well received, and curiously, a lot of children, 12 to 18-year-olds have, or young people, 12 to 18-year-olds have shown up, and their parents have brought them over, and a lot of times their parents will get vaccinated at the same time. We had one school that has done 600 young people from 12 to 18 in the school setting, and that's a big success.
So, hey, you know, look, can we just do a little math really quick? Because one of the questions we always hear about is about, just got off a statewide call at 7 a.m. this morning with Hawkeye and I and others about vaccine hesitancy, how to overcome it. My math is like this. If about 150 million or 120 million Americans have had COVID-19, we've had 600,000 deaths, which is probably, those numbers are somewhere, the 600,000 deaths is right. Who knows how many people have really had COVID-19, but assume it's a third of the population. And now we've had 50% of eligible Americans, which is probably going to push us to around 150 million because it doesn't include really young children now. But if 50% of Americans have had one dose of vaccine, how many vaccine deaths do you think there have been across the country?
From COVID-19?
From the vaccination itself. How many people have died from getting a vaccine for COVID?
I've not heard of a single case.
That's what I'm saying. The numbers are
No,
zero.
not a-
So when we talk about hesitancy, it's like, okay, here's the deal, folks.
Yep.
If 150 to 120 million have had it, and you've had 600,000 deaths, and 120 million people have been vaccinated, and we've had 0 deaths, why is the math so hard?
The math isn't hard, and the vaccines are incredibly safe and effective. So there's no rational reason, in my mind anyway, to be so hesitant and avoid getting the vaccine.
So it's 600,000 to 0. I think I know who wins.
Yeah, we had a question yesterday from Nikki, and I just thought of it when you were talking about the 12 and 15-year-olds. And Nikki said, what if I want to get the shot, but mom and dad won't let me? What can I do?
Well, you can't get the vaccine until there's parental consent.
And that's a problem. It feels tough to say that to a kid who wants to be vaccinated,
Yeah.
but that is the way it goes until you're old enough to give your own consent.
Right, it's because either the parents or in the case of a foster kid or something where there's substituted parental consent of sorts, you got to have consent because that's required by law.
Sherry says, Dr. Norman, are they considering a lottery for Kansas like they have in Ohio?
Yes, we're looking at all manner of things, and we will be doing a big event at the Speedway out in Great Bend. There's going to be a big community program there that I know the hospital and the Barton County are working to have some incentives built in. We will not have $1 million a week lottery like Ohio, but we are working with the Lottery Commission to put together a lottery that will, I think, right size for the state of Kansas, serve as a real stimulus. It appears to be working in Ohio.
That's interesting. So tell us a little bit about how that lottery works. I take it you have to have been vaccinated to play.
You do have to be vaccinated to play, and it doesn't penalize the people that have been vaccinated in the past. They will also be in the pool because it's like, when you sign up for a telecom program, they give the new people the best rates, and then the existing customers, no, that just doesn't feel right to us. So anybody that's been vaccinated will be pulled into that. So it's not a good reason to postpone getting the vaccine until there's some lottery out there.
Right. Okay, so Lori wants to know if it's the honor system for unvaccinated people to wear a mask. Is it safer for me, if I've been vaccinated, to wear my mask around unvaccinated people?
What do you think, Hawk?
Yeah, absolutely. Again, this goes to my individual preference. I'm going to be protected. I'm fully vaccinated. I do assume probably not everybody that I'm around, if I go to places, is going to be vaccinated. I can still contract the disease, although I'm probably going to be well. More than likely not have to go to the hospital. More than likely not have more than 1 or 2 days of very mild symptoms, if any, at all. But if I do get symptoms, I have to go get tested because I work here. If I go get tested and I'm positive, now I'm sitting out 10 days of work, or I can't see my kids because I'm isolated for 10 days. So individually for me, that means a lot to me. I am still going to try to protect myself as much as possible when I go into those public situations.
Agree?
Yep, boom.
I do too.
All right. Jill says, 8 months later, I still have positive antibodies, and so I don't need to get a vaccine, right?
Actually, really good data just came out about that yesterday, Hawkeye.
Yeah.
Did you see this up at the bone marrow, folks?
I saw the blurb. I did not see the actual
Article,
The actual article. To that, I would say that's the wrong way of thinking. We know that you'll have antibodies. Your antibodies may wane. You're still going to have memory B cells that will create antibodies should you encounter the infection again. But again, the guidance is that there is no minimum time between infection with COVID-19 and getting the vaccine. So once that 10 days of isolation is up, we strongly encourage you to go get the vaccination. If you're 8 months out from infection, especially an infection that occurred late last year when there weren't the circulating variants, then strongly encourage you to go get vaccinated. Checking antibodies is not in the guidance for anything. It is not recommended for anything, so I would stop checking antibodies and I would just go get vaccinated.
So one of the things that this paper looked at was your likelihood of and your antibody titer and the number of memory B cells you had in your bone marrow after you've had COVID-19 and after you've been vaccinated. What was clear is that you still have a lot of memory B cells in your bone marrow. It was up to 6 and 8 months after having had COVID-19. But if you had been vaccinated at COVID-19, the odds were far, far greater that your antibody levels were much, much higher, and thus better able to handle that infection. Second point, and remember this is important, if you've had the wild type of COVID-19 and now you get a variant, those wild type antibodies in your body may not be as protective, but the vaccination antibodies appear to look really good.
Yep, even the vaccine to the original strains, we're seeing that those antibody levels are higher. What is that correlate of protection of antibody levels? We don't exactly know, but to your point, the immune response does look more robust to that vaccination, even against those variants, which is extremely important now because we just heard Dr. Norman talk about 70% or more of the isolates that they sequence are some sort of variant.
The other thing I think to think about is that I had a conversation with the White House General Gustav Perna, who has headed up Operation Warp Speed, and he is saying that it is highly likely that there will be a booster available as soon as October. So that is yet to be agreed upon by the manufacturers. But a couple things that would make a big difference, I think, in this discussion is the booster dose becoming available and single-dose syringes for the vaccine, which would be a real game changer for clinical practices.
Yeah, and easier to store.
Pediatricians, family medicine
Yep.
offices,
We,
internists.
and we're taking the Moderna and Pfizer vaccine and J&J. They're now in a number of offices here, and we're fortunate their medical office building so close to the big pharmacy and lots of cold refrigerators and freezers. But the reality is we are pushing them in clinics. I was able to vaccinate a couple of my more hesitant patients in clinic last week, and you walk out of there like, I think that was a big victory. Those people with chronic disease are now truly protected with COVID-19, and they wouldn't have been without that vaccine.
Okay, I'm going to skip down to Mary's question because it's kind of on the topic. Any comment on the report that COVID immunity from vaccine will last for years, possibly a lifetime? She said she read it in the New York Times.
Yeah, that was published this morning. That was an article I was referencing. And yeah, that's a great question. From vaccination, let's be clear, may last a lot of years. And that data has to be pushed out there. It just got published. We're going to hear a lot more questions about that coming out. It's relatively small numbers, but it is really encouraging. But boosters can be given for a couple of reasons. Remember, boosters can be given to make sure you maintain a level of antibody and because of the change in variants. And so, especially with the mRNA vaccines, Pfizer, Moderna, they can pivot almost on a dime and change their formulation a little bit to make sure you're protected against the variant. So there's more than one reason to think about boosters. Team, any other thoughts?
Yeah, I mean, I think that determines, the question is, how do you determine level of immunity? What kind of question are you asking? Are you asking, I want these antibody levels that are X amount high so that I know that if I do come into contact with the virus, I'm going to have those antibodies there? Or am I looking at immunity? Am I asking the question, is my immunity with the memory B and T cells, those cells that circulate or are in the bone marrow, are they going to be able to respond rapidly? Those cells should live on for years for sure. But, that's a little bit different question than what is my antibody level in 1 year after vaccine or natural infection. So I think still the way to go is that we are going to be looking at vaccination and booster at this point in time.
Cindy wanted to know along that line, so is it up to the consumer to get their second shot, not their second shot, but their booster? And should they be checking back with their provider at 9 months, a year?
That's a great question.
Yeah,
I'm going to just say to my patients, we're going to be in touch. You're going to get information from our health system. I know our health system will take a strong role about saying, here's what our recommendations are for you to get boosters. So our patients will hear from us about that. I'm just going to guess that the boosters are going to be about annual for a while. I'm going to guess that that's right. Thoughts?
I think that's likely to be true. We just don't know yet. We don't have guidance from the CDC yet, so we'll just have to get back to you on that. But I think, I think it's our collective instincts tell us that it'll be a booster for some time into the future, maybe hopefully on an annual basis.
Yeah, and I bet it's not more than that. But again, we're still building the airplane while we fly it, and though we have a lot more parts, and the plane has gained altitude and has a couple of engines going, we still got more work to do.
Yeah, I do believe, and I think a lot of experts believe, that you are going to have that durable, robust immune response after vaccination for at least a year. I think what will contribute if you need a vaccine booster sooner than a year is going to be the infection dynamics in your community, and those infection dynamics also include what are the concerning variants. Because the only booster that I know that is being worked on right now is that mRNA booster, which is directed against that South African variant spike. So.
Jody wants to know if you know when that booster, and she says Moderna, but do you know when the timeline for it?
You had mentioned
Moderna and
October,
Pfizer.
but
I'm thinking they have targeted September, October for that booster to be available. So, we'll have to sit back and wait and see when Pfizer and Moderna will come out with that. But I think that's probably going to be about right.
I think so. I want to comment on something you said, Dane, and that is about community spread. Because I think for some reason people think that herd immunity will be equally applied to 105 counties in the state of Kansas, and that's not going to be the way it is. I guarantee you that Douglas County is going to be more highly vaccinated sooner than some of our more western counties. It's not like you can take everybody in the state of Kansas, put them in a brown paper bag, and then sprinkle them out equally throughout the state of Kansas so that there's equal, homogeneous immunity. That's just not how it works. And we're going to still be beating this into submission for a very long time, more in some counties than others.
Isaac says he thinks that you ought to go to the pools when they open. He thinks that would be a great place for you to set up your. He wants to know if you thought of that.
Can you go to the pools and give some vaccines?
Duly noted, and wear
about
sunscreen.
it.
when you
Yeah, I
do
was
it.
going to say, offer sunscreen and vaccination.
But we can
Right.
wipe the sunscreen off and give you a vaccine. I like that. That's a good idea. Out to the lakes, out to Party Cove. I guess that's on Lake of the Ozarks, but I suspect other places have the same thing.
Right. Erin wants to know, do doctors' offices have the vaccine to give when you go to see them? She wants to know if it's in
Yeah.
the offices.
It is here at KU, and it's not in every single office. And
Yeah.
you maybe know better than I do. I know the pulmonary office has
Yeah.
it, primary care offices, pediatricians, I think infectious disease.
ID, room. They are rolling it out to everyone, but initially those were the ones. And probably by now they've rolled out to most
clinics.
especially here on campus in our medical office building and our transplant
And I think
clinics.
is Amanda here tomorrow? I won't be here, but you're here tomorrow with Amanda.
Yeah.
You guys can. Amanda will know that question because she knows everything.
We do know
That's
that
right.
in the state of Kansas, that 20% of the vaccinating sites now are medical practices. I don't know what the denominator is, so I can't tell you
Yeah.
exactly how many. And maybe you want to comment on this, Dana, that the Pfizer has changed its storage
Yeah.
rules, and it makes it much more friendly to being in physicians' offices.
Yep, up to a month in refrigeration. So.
Yeah, but you still have to then kind of dilute it or pull it out and do
Yeah.
things in the office. But what the key is having a good distribution system. So your pharmacist or someone are handling the virus at the local clinic, your nursing, whomever, and that they still have to finish it, that's final preparation. But I think that last point that you've made, Dr. Norman, that it can be in the refrigerator for up to 30 days at a refrigerator temperature is really good. I think we're going to find that's true for both Pfizer and Moderna. Moderna was originally tested at a warmer temperature than Pfizer, so they had a little bit of an advantage on that. Now Pfizer's come back and said, oh, look, we're so good at this. But the reality is they're both going to be the same at the end of the day.
Yeah, and I think to Dr. Norman's point earlier, these are currently in vials of multi-doses. We're hoping that they'll get just in single injection doses. And again, we know that there was a well-publicized case about a woman that got actually the whole vial of 6 doses of the mRNA. I can't remember if it was Pfizer or Moderna, who did well, the last I heard. So even in that overload of vaccine dose, they did well. But hopefully we can get down to those single doses of vaccines.
Wow, I hadn't heard that. Kelly, she got her first dose of Pfizer last Friday, and
Well
she
done,
says,
Kelly.
I've been.
Good job.
I know, I think that too. She goes, but I've been so sick. Is that common? Could you go over the side effects
Yeah,
and
you
what's
bet.
normal?
It is not uncommon that you get sick from these vaccines.
Yeah, I wouldn't say that it should last a week,
Yeah,
though.
weeks little long.
Probably, at most 36 to
48, I think.
48,
hours,
48 hours, really. But those should wear off pretty quickly. I don't know what she means by sick. A lot more details would be needed, but you should be feeling better after that 2 to 3 days.
Hopefully you're still showing progress. Most patients will have their fevers and chills and headache last a day or two. I mean, especially after my second dose, I felt like I had the flu. I felt terrible. It was gone in 24 hours. Now, some folks have reported fatigue for up to 5 to 7 days. So if feeling sick means I'm still a little tired, that may be true. But after that, man, you should have full resolution. If you're not, I would talk to your primary care physician and make sure you don't have another problem as well. And you can still get, especially if you only got, that's your first dose, you can still be getting COVID-19 or any of a variety of other viruses that are out there in the community.
So Sean wants to know, is it fair to say that unvaccinated people are the most at risk right now if they don't wear a mask?
Absolutely. I don't think there's any question about that. And
And the ones they hang out with?
yeah, that's the problem. A, if you're not vaccinated. B, if you're not wearing a mask. And C, if you haven't had COVID, you're really at risk, right? That risk has not changed for you. There is some evidence that suggests if you're a single person and you're around a lot of people that have been vaccinated, you're a little bit safer because you're less likely to have it transmitted to you. But the reality is you don't know who's been vaccinated, who hasn't. And so I think you're just, you're kind of throwing the dice out there. If you're not vaccinated and you're not masking and you're around other people who are the same, you're going to still spread the coronavirus because, Dr. Norman, there is still widespread community disease.
Yeah, yesterday we reported over a 2-day period 446 new cases and 9 new deaths just in the 2-day period. So, that's 225 cases a day in the state of Kansas, and as we've talked about before, that's probably underrepresented. So we still have a ways to go.
Yeah, we have a long ways to go, and I think what we have to remember is vaccines keep you safe, but there's only the way it can be done. You've got to be vaccinated. If you're not vaccinated, you're not safe.
Angela wants to know any timeline for those under age 12 to get the vaccine.
We're all dependent upon the Pfizer. I think they've actually initiated most of the kids at the studies in the infants, Moderna as well, from age, I believe it was 2 and above. And there's some people looking
Yeah.
at 6 months to 2 years, guys.
No, yeah, I don't know as far as timeline. They are looking at 2 years and even as down to 6 months of age. You know, we give the flu vaccine for children 6 months and older. I believe it'll probably be expedited, probably by middle or end of July. We'll have data and understand if it's going to be approved.
Yeah, ditto. Hopefully, by the time we start school in the fall or before late fall and winter would be optimal, but we haven't gotten any guidance on that.
I believe that Pfizer, Moderna, I think it was Pfizer, was going to hope to show their data by middle of July, and then they would go to the FDA for early use authorization, hopefully be ready to give it in August, and you'll be right hitting up against that cusp of when schools are restarting. But I think it is going to be available then.
Okay, so it's 8:40. The questions are still flooding in. I want to let people know you're back on Tuesday, correct?
You know more about me than I do,
Yeah, okay.
apparently.
Yeah, I think we have a
And we should
fun.
maybe invite you back tomorrow. I mean, the
We have a
questions-
fun program on Tuesday, I think, for you next week
Oh.
too, because you're here with Sharice
Representative
David,
Sharice
so that'll be
David.
fun.
Good.
Well, we're gonna, and I think we're all going to be in the studio that day. Is that right? Is that
Right,
what we're
right.
thinking?
The studio's going to look different because we need to keep everybody separated still because we're a hospital. But yes, we are going to make it work. So just a couple of more questions. Oh, and a suggestion. Sandy says go to street fairs and summer events to take your mobile van, she says.
Noted.
Mike wants to know, when you go there, what kind of vaccine are you offering people in those pop-up clinics?
We're offering all 3 of the currently approved vaccines in events like that.
So people can choose what they're going to get?
Yes.
Wow, that's a.
Yeah, we would, for people that we don't have any relationship with, or they're not we're not a clinic, we're a vaccinating site, the Johnson & Johnson makes a lot of sense because then you're one and done. Still have a terrific amount of confidence in the J&J product, but we have all 3 available. People have opinions, and we want to be able to not have anything get in the way of the vaccine.
All right, last question.
All right. Well, we have to continue to play whack-a-mole with vaccines against variants indefinitely, as some people have thought. That's from
I
Isaac.
don't know about the whack-a-mole because so
Yeah.
far the vaccines we have, Hawkeye,
Yeah.
work well against all the variants,
They do.
including the ones coming out of India and South Africa.
Yeah, I mean, the most recent benchtop and real-world data does show that you still have protection from those most severe types of disease, including death. But I think there's always that room to optimize that immunity, especially to some of the variants that may arise that may have more immune evasion. So I think that will be important to do. We do this with flu every year, and that vaccine isn't even as efficacious. But I think doing that will just allow us to continue to, again, like I said, optimize our immune response.
And Dr. Norman, my sense is that the booster may be reconfigured on a yearly basis, but I don't think you're going to have a lot of shots in between unless we see the rise of some variant that we don't know about.
Right, I agree wholeheartedly.
Just one more real quick, I promise. Mario just wrote in this really good question, I think. He said that a friend of his passed away on his second battle with COVID-19. He wasn't sick the first time. Is that common?
Well, it's unfortunate, but I would say that it's not uncommon
No.
because you can get COVID-19. And again, to our point, if you've had COVID-19, you're really not protected the second time unless you're vaccinated. And so what we know is that it doesn't matter if you've had it once, the second time, and we've seen a lot of reports of this, that you can
Yeah.
get sick and die from it, Hawk.
Yeah, I mean, before vaccination, we saw very good published reports of people that had reinfection with COVID-19, and those outcomes were variable. Some people had no symptoms, some people had less symptoms, but others had worse symptoms and even died. So we don't have a good handle on necessarily what happens with reinfection, especially now with some of these variants that are circulating. This was late last year, again, before vaccination. So we don't have a good way to predict if somebody's going to be perfectly fine and have no symptoms or have worse disease than the first time.
Anything else?
About that?
Yes, sir.
No.
All right. Tomorrow is Friday Follow-Up with Amanda Cackler, the Director of Quality and Safety. We'll also hear from Chelsea Smith, our outreach coordinator with the Community Blood Center of Greater Kansas City. She will explain what's driving the current blood shortage. And folks, we've been talking with Chelsea along the way. It is so important to make sure we continue to donate blood. All of our lives depend on that. Okay, Dr. Norman, we promised a special shout out to your biggest little fan. This is Celeste, or Cece. Nice mustache, Cece. As I think you know, she is 4 years old and a big fan of yours. But her mom, Ashley, says she's also a big fan of the morning media update that she listens to as she walks her way to daycare. Thanks for listening, Cece. You're adorable. I don't know about the mustache, and I don't know about Dr. Norman, but we're glad you're a fan of the morning media update. Okay, guys, final thoughts.
Just, you know, okay, I have to say it. The Kansas Legislature is looking to terminate the emergency declaration. So watch for the newspapers for that. I want to emphasize to everybody that if they choose to terminate the emergency declaration, it's not that this emergency is gone. So get vaccinated and keep doing the stuff you know will keep you from getting infected.
News will always come back if people don't do that, right? Because we can always see the numbers that go right back up.
Look at Taiwan and look at Canada. If people let their guard down, it'll be a problem.
One of the biggest hotspots in the world right now is in Manitoba, Canada, where very few people are vaccinated, and there's a whole lot of COVID. Final thoughts?
Yeah, I mean, it's rainy outside, but overall, I think it is bright in the fact that we are fortunate enough to have vaccines here in the United States. We have a lot of supply. We have seen what vaccination does to driving down disease, to driving down hospitalizations and death, especially in those most vulnerable populations. We can continue to do that with every population to help reduce the amount of hospitalizations and overall sickness, so please continue to go get vaccinated.
I want to thank Dr. Lee Norman for being on our program today. Lee, you've had to take a lot of shots this last year, and I just want to thank you for your great public service, your calm and steady voice, and your honest truth-telling to all of us. We think you fit right into our program. No flapjacking out there. Not going to flap our arms and jack with the truth.
And I'll come back again as long as you promise not to sing.
Yeah. Oh, I can never make that promise. You know, I was listening to little John Denver on the way. I'm sure I could break out into a little country roads, take me home. Anyway, folks, we're going to be back tomorrow. Remember, until you come back, those rules of infection control, they do still travel with you. They do still protect you wherever you go. And there's still no place like home. We'll see you tomorrow.